Hi, I'm Dr. Scholz. Let's talk about prostate cancer. In this video, we're continuing our series of the PCRI staging guide. In particular, we're covering the Teal stage, otherwise known as intermediate risk prostate cancer. Teal is a very broad-based stage with some men who are in low Teal that can do active surveillance, and some men in high Teal that need combination therapy. In today's discussion about proton therapy, we're talking typically about giving proton therapy by itself, although it can be used in combination with hormones and seed implants, but this is done much less commonly. So for most men, proton therapy would be appropriate for someone who's in what we call a basic Teal. That would be a sort of an intermediate risk prostate cancer. Other options are doing just a seed implant or just IMRT or just surgery or hormone therapy. I think of proton therapy as being very similar to other forms of beam radiation, such as intensity-modulated radiation therapy or IMRT, which is sort of the standard for beam radiation these days. Practically everyone's heard the marketing pitch about proton therapy being less toxic than IMRT because the radiation enters to the target, but unlike regular X-rays, doesn't exit out the backside of the body. So only half as much of the body is exposed. And on paper, that looks great. And in practice, it appears that IMPT, or intensity-modulated proton therapy, is certainly tolerable, and the side effects are no worse than IMRT. Unfortunately, there are no definitive studies that have ever shown that intensity-modulated proton therapy is less toxic than intensity-modulated radiation therapy. It is much more expensive. There are relatively few centers that do it, but all in all, in the practical day-to-day decision-making for prostate cancer therapy, I tend to think of intensity-modulated proton therapy to be very similar, if not identical, to intensity-modulated radiation therapy. Now, you may have not heard the terminology intensity-modulated proton therapy, and everyone should be aware that older conformal proton therapy that started back in the 1990s is still being done in some centers around the United States. It's decidedly inferior to the modern computerized type of radiation that is available called intensity-modulated proton therapy. And if I was going to undergo any type of beam radiation, and if it happened to be proton therapy, I would never use the older conformal type. I would only go with IMPT, or intensity-modulated proton therapy. Most of the new centers that are being built deliver IMPT, not the old conformal type of proton therapy. So if you just sort of change out IMPT for IMRT, you can go back and refer to our video on IMRT for Teal that we have already put online, and look at the pros and cons of IMRT compared to things like seed implants and whatnot. The bottom line is that the beam radiation doctors with IMRT or IMPT are unable technically to deliver the same dose of radiation that can be delivered with a seed implant. So if it comes down to looking at some form of beam radiation with some form of seed radiation, typically, if you're looking purely at cure rates, you're going to get a higher cure rate with a seed implant than you are going to with intensity-modulated radiation or intensity-modulated proton therapy. So why would you use IMPT or IMRT in anyone if seed implants provide higher cure rates? Well, if you're looking at Basic Teal, which is just one step away from active surveillance, the low Teal patients, the cure rates are going to be excellent with just about anything you do. So some men may prefer a non-invasive form of radiation rather than seed implants, which are invasive. It requires a procedure. Needles are stuck in, you get anesthesia and all these sorts of things. So the beam radiation is attractive because it's non-invasive. Now, both IMRT and IMPT historically have required daily visits, Monday through Friday, for a short treatment over a 9-week period. This is changing rapidly, and both IMRT and IMPT as of 2019, it appears, can be safely given in 5 weeks, which is far more convenient, appears to be equally effective, and it does not appear to have any additional side effects. So 5 weeks rather than 9 weeks of therapy is rapidly becoming the new standard time period for IMRT and IMPT. So I don't have any really additional comments about IMPT as it compares to IMRT. It's a perfectly good form of treatment, just as IMRT is a perfectly good form of treatment. If you happen to be situated geographically close to a proton center, because remember you have to go there for 5 weeks, it's perfectly reasonable to do IMPT for basic teal and consider it as a form of combination for high teal, although you'd be adding a seed implant and some hormone therapy. Please see our video on combination therapy for teal to get more details in that regard. So in summary, as a full-time prostate expert, I view IMPT as interchangeable with IMRT. Whenever you go for any form of treatment, you always want to go to a reputable center that has a large volume of prostate cancer patients, a lot of experience and practice delivering this type of treatment. But assuming that basic criterion is met, IMPT is a perfectly reasonable form of therapy. I do not recommend it as being advantageous over IMRT because there's no scientific evidence, and in my own daily experience, I have not seen any difference in outcomes.